I'm Paul Hebert. I am a research associate professor at the University of Washington and a core investigator at the Seattle-Denver Center of Innovation, where we're looking at how veterans choose to use the VA versus a non-VA provider. So this is important because it gets at the competitiveness of the VA in sort of the overall marketplace for veterans health care. You think of the experience of care that a veteran gets at the VA, and that could be, anything like how easy is it to access the care, the out-of-pocket cost of the care, the service that you get when you're at the VA. All those things add up to the patient experience. And if the patient experience at the VA is good relative to community providers, you would expect veterans to vote with their feet by using more VA care and less VA care. But in truth, we've been running this experiment for the last 50 years. Like ever since Medicare, we've given the veterans the ability to either use VA providers through their VA benefits or community providers through their Medicare benefits. This is a lot of people. This is half of all veterans are Medicare eligible. So this is a lot of veterans over a long period of time, so fertile ground for doing some interesting work on VA competitiveness. So we looked at two things. The first question that we looked at is who is the veteran that decides to use the VA? So who is our core customer, basically? And to do that, we took a bunch of veterans who were turning 65 around the year 2000 and had filled out this very detailed health survey, the large health survey of enrolled veterans. So this is back in 1999 when they filled out this survey. And then we looked at their healthcare use in both the VA and Medicare up until 2016 and divided them up into cohorts of veterans who use mostly the VA and mostly Medicare. A person who uses more than 50% of their care from the VA actually gets about 90% of their care from the VA and 10% from Medicare. And the opposite of true for people who use Medicare. They get like 10% of their care from the VA and 90% from Medicare. So it's a really nice separation of Medicare-reliant and VA-reliant veterans. The first thing that we looked at was just who was our core customer. The second thing we looked at is how is the VA doing in this competitive marketplace? So, are we thriving or are we failing? So to answer that question, we looked at veterans who were Medicare eligible from 2003 until 2014. And followed their use in both Medicare and the VA. And the idea was that if the VA is thriving in this marketplace, we should see them, maintaining their market share, if you will. The percentage of care that they get, that a veteran gets from the VA should hold pretty constant over time. The veteran who decides to stay with the VA over the long run had greater social risks, greater health risks, and more challenging health behaviors. So, veterans were much more likely to say that they lived alone, or they had no one to take them to the doctor if they needed help. They were much more likely to say that they were either in poor or fair health, and much less likely to say that they were in excellent health. And they smoked more, drank more frequently, and were much more likely to say that they never exercised. So our core customer is among the most at risk of veterans who use the VA currently. The VA is not maintaining a market share, it's increasing it, and it's increasing it a lot. So for example, for primary care, in 2014, about 25% of primary care visits for a veteran were in the VA, and 75% were in Medicare. By 2014, that 25% had jumped to 35%. I love working with veterans. I have to say, I am a researcher in my genes, and so the fact that they are constantly coming up with interesting ideas to to look into. I just love that aspect. In addition to the voting with your feet work that we're doing, I'm also doing some work in behavioral economics, and especially in behavioral economic solutions to weight loss and exercise among veterans. We've been sort of like asking people, is this going to be a problem, not knowing how to lose weight? And a veteran, I said, do you know how you're going to lose weight? And he said, oh yeah, I got it all figured out. I retired a while ago, and my wife says I got to join this trial because I'm just sitting around getting fat watching Netflix. So I organized a bunch of people in my neighborhood, and every day we go out and we pick up trash along this trail, and then we go out to the water and pick up plastics that have washed up on the shore. It is so cool. It's such a good idea. And when he said it, I just turned to the Emily and Christine who were with me, and they're just like, oh, that is such a great idea. And we just said, as soon as you are out of this trial, we are going to give you a call, and you're going to help us set that up to study this in a study.